Hey, this is Dr. Chavez, and today we're going to talk about headaches, why they happen, and what I do when I have patients that have headaches. According to the Mayo Clinic, primary headaches are caused by irritations of nerves, blood vessels, or muscles, or possibly chemical activity in the brain. The first x-ray that I have up there shows what's considered a normal cervical curve. Okay, with that, you can see the little red arrow is going to point to C1, and C1 is at a curvature or a plane of 31 degrees. It's going to be really important, and we'll talk about that in just a second. The next x-ray I have up here, you can see, isn't quite as curved, and you can see C1 is pushed really high up. In a second, I'll show you the degrees of each of these, and you'll be able to see why that's so important. As you can see on the first x-ray, you have a 31-degree curve, leaving plenty of space between the base of the skull and C1. And on the second x-ray, you can see it's at a -6-degree arc, and that actually leaves 0 to no room, and it's basically pressing right against the skull. As we come to the next image, which shows a picture of the back of the skull, as well as the neck itself, what you're going to see is C1, the top vertebrae, and I'm going to highlight that in blue. And then above that, there's going to be a space between the skull and C1, and you can see right down into what's called the dura mater, and below the dura mater is the medulla, or the bottom of the brainstem. Those are really important. The medulla actually controls your heart and lungs, amongst other things, as well as the vagus nerve comes off there. I'll have a different video about that later. On top of that, to the left of the medulla, you can see the vertebral artery, as well as the C1 nerve root. And then as we turn to the side, you can actually see how tightly fit the vertebral artery, C1 nerve root, and the dura mater that comes out are that tight between C1 and the skull. So as we go back to the original first couple x-rays, when you look at the first one, you can see how necessary it is for that space to be there and why that 31-degree curve is as important as it is. And then we go to the next x-ray, and it becomes even more apparent how horrible that is for your body, your nerve roots, your medulla, all the above, for your C1 to sit that tight and that close to your skull. Now what I'm going to do is I'm actually going to show you an adjustment on how I actually introduce the curvature back into the neck and get that to drop down from a -6-degree curve all the way down to a 31-degree curve. So earlier in the video, we saw C1, and C1 is located right here. What we're going to do to start reintroducing that curvature and getting that angle back in the neck that we were looking for is I'm going to adjust C1. Okay, what that's going to allow us to do is take pressure off C1 nerve root, the dura mater, as well as the vertebral artery.